Hi there. Here we are with our patient Jose. We have not seen Jose since about 2009. So we're talking 17 years. A lot happens in 17 years. We were both a lot younger back then, for one. But anyways, the first thing I couldn't believe how good he looks, as far as how young and handsome he still looks. And then we were looking at the pictures, and he had a little bit of hair loss throughout the years. And that's what I want to make sure we're talking about. So when I had him as my patient back in 2009, I would have always discussed preventative treatments. For whatever reason, you didn't do it. It happens.
I didn't do it.
He didn't do it. It's okay. That's part of it. It's very common. And now he's here for another surgery. And I was just saying to him, well, let's get you on the preventative treatments so we don't do this again in another 10 years. And so that was the conversation we were having. But were you happy with the results that we got you?
Oh, very happy. Yeah, it's been great. It's just, by not taking the pill, I guess that's the reason I'm here again.
Put you back, yeah. So by you not taking the pill, you're giving me more business.
There you go. Good for you.
Well, I'd rather you be a happy patient, but no, that's how it unfortunately works. But anyways, we recreated this whole entire hairline that you're looking at here. So when you see the pictures, we created this nice, natural, beautiful hairline, all these little tiny one-hair grafts. Went back through here with these density grafts, which are undetectable. And everything you're seeing here, from here to about here, is now a hair transplant because he virtually lost all the hair on the top of his head. I'm going to just spin you around and show you what happened. So when we do that MaxHarvest hair transplant, we're harvesting all the way around to the other side. And you can see on the old pictures that we're going to show of him, he had hair all the way through here. And then what happened is, this hair opened up. We built into the existing hairs over here to make sure we created a border. So this secures this into the side. So we don't have to do that today. And now we're able to just focus on restoring his crown and putting this all back together for him. So it's an easy fix. He's got beautiful donor. This is his old suture line hidden back here. You can't even find it. I mean, look at that. There it is. I mean, that's the suture line right there, which is it's undetectable for the most part. I mean, you have to really know what you're looking for to find that. But there it is. So he's got beautiful donor. We're going to do what's called a density case, where I just cut, I'm going to just bring you back a little bit here, where we cut for what are called the multiple. So I created this to look like a natural crown in the back. So that's done in the event the patient loses hair. So this is one of those perfect examples of what happens over time if you're not on your preventative treatments, how it's going to look. And so I created so it looks nice. I call it my movie theater view. So when you're behind the patient in the movie theater, it still looks natural. I created a separate hairline back here. My density grafts are in that center, all buried in there so you can't see them. So when you look here, undetectable. People are always asking, well, what are those big grafts? You can't see them. They're undetectable because they're buried in between with the small grafts, and then it creates that natural looking crown if they naturally lose hair. So this is one of those great timeline examples, no offense to use you as that, of the withstanding, the work withstood the test of time. It still blends in perfectly in the front. It came out perfectly natural in the back. I'm basically patting myself on the back for the long-term plan I had back for you back then. It lasted. So today what we're doing is a density case with all those nice strong grafts to just thicken that up. Hopefully I'm going to talk him into getting on the preventative treatments, and hopefully we don't see each other in another 17 years on this setting.
That's the plan.
All right. So what do you say to the patient that's out there that's thinking about doing this, that's afraid to do it? What do you say to that guy who's at home?
I would just do it if you're thinking about doing it. This has been what 16, 17 years.
17 years.
17 years, and I love it. It's the whole thing is there. What you did back then is still there. If it wasn't for that, I would have been bald all the way.
Exactly.
So if you think about doing it, just do it. It's a great deal.
Awesome. Thank you very much. Appreciate you doing the video.
Appreciate it.
Thank you.